Next, we have a question about ABA, wondering, is ABA the best therapy?
Yeah, so ABA is very popular because it is very, very well studied. And there's a lot of really great things about ABA because it is very data driven. So you're constantly evaluating and constantly moving forward. I think the important thing is that ABA is really great at some things, but not so great at other things. And especially with individuals, you have to look at what you're targeting. So ABA is really good at teaching specific skills. For example, if you're trying to teach a specific skill, ABA is really great at that. It's also great at trying to teach other ways of regulation, for example, and minimizing some behaviors that may be harmful. So there are some individuals, for example, who engage in a lot of self-harm. And so it's very good at targeting some of those things as well. As a psychologist, I often like broad-based, developmentally based programs that have a component of ABA, but also do other things as well. As we've talked about, like understanding the regulation piece, understanding the communication piece, and then insight-based things can be really helpful. So ABA can be really good as part of a larger comprehensive program.
Mm-hmm. Awesome. Super helpful. From Caroline, what are your thoughts on autistic adults generally thinking negatively of ABA? Do you think ABA has changed for the better?
Yeah, it's really interesting because psychology, psychiatry, medicine has often there are many things I think in the past for a lot of different professions that looking back we can't believe we ever did. So if you think about like some of the things that you learned in history, for example, of things that we thought would be helpful. So even things like bleeding people, because we thought that this would help, and not realizing, of course, that this might cause other problems. Understanding where germs came from, and so unfortunately, ABA did have a negative reputation, especially in the beginning, for basically forcing people to conform very specifically and rigidly to what was considered normal. And there wasn't, again, an understanding of neurodiversity, as well as labeling behaviors as being bad rather than this isn't helpful to you or this is actually getting in your way. Again, we now, hopefully, most of us are trained to think about things from a functional standpoint. How is this behavior helping you, or how is it getting in your way? It's not necessarily wrong or bad. It's just, we again want you to make decisions about what you want to do, knowing what the effects are, the pluses and the minuses are. ABA, especially in the beginning, because like pure behaviorism it can feel very cold, it can feel very sterile. There isn't, you can see videos of like how ABA used to be done many years ago that look pretty bad, where the individual is clearly upset and the person is not paying attention to that and is just moving on. So yes, there are many negative things about kind of, especially what might have happened in the past. I do think that ABA has changed for the better. A lot of ABA companies actually incorporate many other ways of working with children that are much more broad-based and much more developmental. And so there's always room for improvement, always in anything, and as well as taking in feedback from families to make things better. I do think that it is absolutely moving in a good direction, but there's always a lot of room for improvement.
So, as a parent who's getting a treatment like ABA, how would a parent know if the treatment is working?
Yeah. Are we making progress towards the goals?
Mm-hmm.
So again, one great thing about ABA is every 6 months, they're supposed to be, and actually even more than that, they're supposed to be doing an analysis of how are we moving toward goals. It's the same in IEPs or individualized education programs. There are goals, and then there's a breakdown of what constitutes movement. And so as a parent, I would recommend that you just work in close conjunction with your treatment team to say, what does this mean? Because sometimes the data points don't always make as much sense outside of the session, to be like, how is this movement towards the bigger goal? And so checking in with your team can be really helpful.
Mhm.